numbers. Sorry, forgive me, for Morocco. Maybe Maria, you can start.
Yes, so according to our data as of yesterday, 35,195 cases. New cases in the last week, almost 8,000 cases in the last week.
Maybe to, and the number of deaths I think is 556. And I think if you see the situation, it's not the number of cases, but the trend is on the increase, both in the number of cases and deaths. So I think Morocco should do more, especially to reverse the increasing trend that we're seeing now. Compared to many countries, actually, if you see the number of deaths, it's low, but with the increasing trend, you know, it may, if it continues to increase, it may get serious. So our advice is, with the increasing trend, to be more aggressive in the interventions that they take, tailored to, of course, the COVID situation at subnational levels and below, and tailored action can be taken in areas where there is more contribution of cases, because we don't think that the situation is very even throughout the country. So they can focus where the concentration of cases is, and where especially the new cases are coming from. But the last August, the week of August 3, is the highest since the outbreak actually started in terms of number of cases, which is almost close to 7,000 in a week, which is the highest number of cases reported.
And if we can supplement as well, while the numbers, for example, across the Eastern Mediterranean, North Africa, Middle East, numbers in places like Saudi Arabia, Pakistan, and others are falling, and in the Gulf countries, we've certainly seen rapid increases in Morocco, in Lebanon now, unfortunately, and that's a big concern in the aftermath of the explosion. There is the rising number of cases in Lebanon and the stress that the health system is under. But similarly in Syria and Iraq, and of note, in the last 24 hours, Iraq has the most cases, new cases, reported from the Eastern Mediterranean region. I believe that's the first time where Iraq has had the top number of cases for that region. So I think we're seeing a very dynamic situation in the region. Morocco has also had some previous issues of clusters of infections in prisons and other places, and again it shows the difficulty. When you get clusters established in certain areas and certain groups, you may end up with those clusters extending into full-blown community transmission. So Morocco is not alone in North Africa or in the Eastern Mediterranean with an increasing trend of cases, and as the DG says, every country now needs to double down, examine what it's doing, where it's doing it at national and subnational level, and effectively use the tools that we do have. And Morocco has, if you go back over the last number of months, actually Morocco had a very, very low level of disease right the way through the early parts of this pandemic. So there's no question that Morocco has the capacity to do that. Every country has had to contend with flare-ups. Every country has had to contend with this disease bouncing back. The question is not, does the disease bounce back? The disease bounces back. It happens. It's a virus. It exploits weaknesses and gaps in our system. The real test is, how do we react? How do we respond as a government, as a community, as a society, and as individuals to that reality? And I think that's what we would ask each country to do. Don't lose hope when the disease bounces back. Don't blame others. Take action. Everyone takes action together in response to a jump in disease. Then the disease will go away. It will be pushed away. I think in too many countries, we tend to look for scapegoats. Whose fault is it that the disease is back? Who made a mistake? In an emergency response, there's no time for that. It's a time for action. When the emergency is over, you sit down and then you say, okay, who did what? Who was slow? Who was fast? And during an emergency, we need everyone to act together and act quickly. And I think Morocco has demonstrated right the way through this pandemic its capacity to keep disease at a low level Morocco needs to get back there again, with many other countries who are in a very similar situation.
Thanks, Margaret. Just to Mike's point, this really comes back to what Kai asked earlier about this leveling of virus that we're seeing globally. I mean, what we're actually seeing, and as Mike talks about all the time, is two factors. The first is the scale of the susceptibility in the world. The vast majority of the population in the world is susceptible to this disease. The second thing that we're seeing is the stringency of the application of control measures is dropping. People are coming closer together, as Maria's been talking about. Masks aren't being used always the way that they should, et cetera. And so any leveling of the disease that we're looking at should just lulling you into a sense of false security, because this disease, like Mike's been emphasizing, has lots of space to still cause trouble. When it does level, Kai, we have to take advantage of that opportunity to really get the testing in place, get the isolation capacity in place, get the contact tracing and quarantining working, because the vaccines are not going to be here tomorrow, but the virus is here today, which means we've got to use the tools we have today, or we're going to see these flares just like our caller from Morocco emphasized. But there's so much can be done long before we have a vaccine.
Thank you so much. And on that important note of hope and action, I will close the press conference. Remember, we will post the audio files, and we will also post a copy of the Director General's speech. Now I'll hand over to the DG.